The CAQ government wants to implement stricter regulations regarding where and how safe consumption sites can operate in Quebec. These are sites where people can consume drugs in safety and be taken care of in case of an overdose. Community groups say these places are essential to prevent deaths and reduce the spread of infectious diseases like HIV. The legislation, called Bill 103, would ban supervised consumption sites within 150 meters of a school or daycare. It would also require an organization wanting to open a site outside of a facility managed by Santé Quebec to seek approval from the health ministry. The ministry would also be able to impose conditions to make sure the areas around the site are safe and clean. These sites would have permission to operate for 4 years, after which organizations have to renew their authorization from the ministry.
If we want to be able to develop these sites, this needs to be done securely and with the population believing that it can be safe as well. So with these clear guidelines, I think it'd be much better.
Now, there is a bit of a grandfather clause for organizations that already operate these sites independently. As of the law being adopted, they would have 4 years to continue operating these sites, after which they have to go through the entire application process with the ministry, meaning that if they are too close to a school or daycare, they have to relocate or close entirely. The province says that right now there are only 2 safe consumption sites that are within 150 meters of a school. Maison Benoît-Labre is one of them. The supervised consumption site and day shelter opened near an elementary school in Montreal last year. Residents have complained that it brought all kinds of issues, including theft, violence, public drug use, and nudity. But some experts say that this legislation is going to make it extremely difficult for those services to exist at all.
In the end, it will be very difficult to have any such services in downtown, and where people who use drugs live and need those services.
He says he expects the legislation could face legal challenges unless substantial changes are made.